Hi, my name is Grant Hoofer. This is Mr. B, and today we're going to be going over manual restraints. The first manual restraint we're going to be talking about is the halter. The halter, as you can see, is going to sit on the horse's head just like the regular bridle would be, with the noseband right along the nose and about 2 fingers from the cheekbone. It's also going to be significantly loose underneath, probably enough for you to fit your fist in. And the top is going to go over the pole right behind the ears and be easily able to move around. In addition, you also have your lead line, which can be clipped to the bottom of the halter here. The next manual restraint we're going to be talking about is the nose chain. In order to do the nose chain, you're going to take your lead rope, which has a chain on it, and run from the outside of this chain over across the noseband, pull it through, and up to the ring here. You always want to make sure that the little knob is facing out away from the horse. Another thing to remember is sometimes when you pull down, having it clipped here can pull it into the eye. So you can also take your chain and run it under along the chin and up to this opposite loop with the buckle facing out in order to more evenly distribute the weight or the pressure of the chain. The next manual restraint we're going to be going over is the lip chain. In order to do the lip chain, you're going to take your chain and run it through just like you did with your nose chain, except you're not going to cross over the noseband. You're just going to go up and clip to the top flap, making sure the buckle is out. You're then going to pull the rest of your chain through, making sure it's flat, and gently place above the top of the horse's gums and pull down. So it looks like that. You're going to want to make sure that you pull down with steady, even pressure so you don't let the chain fall out of the mouth or go too high up into the mouth. And then in order to let it go, you just gently release it down. And that's how you do a lip chain. Our next manual restraint we're going to be talking about is the lip twine. Lip twine can be used if you don't have a lead rope with the chain or you're somewhere where a chain is not easily available. And at most barns, the baling twine will be anywhere and easily accessible. You're going to start this off by running it through just like you did for the lip chain, over across the nose. And for this restraint, you can tie it to this ring that's lower. And you're just going to double knot it to make sure that it does not come loose. Another reason lip twine is helpful is because it's less jangly and jingly. So if you have a horse that it's harder for you to get a manual restraint on, this can be a simpler and quicker way to get it onto your horse. You're then going to just gently push up and allow the twine to go up along the lip and the gum of the horse, and pull down with steady, even pressure. And when you're done with the restraint, again, you'll loosen up and allow it to just gently come out of the mouth. Oh, Mr. B. And that's how you do the lip twine twitch. Our next manual restraint we're going to be talking about is the shoulder roll. When looking at the shoulder roll, you're going to imagine the triangle like you would if you're giving an IM shot, which you're going to watch out for the scapula, the nuchal ligament, and the spine. So it'll be somewhere in this triangular area here that you're going to do the shoulder roll. The shoulder roll is important for a person when you're giving a shot or something quick and easy needs to get done and your horse is being a little difficult. It's just a way to kind of take their attention away for a split second and get done what you need to get done. When you do your shoulder roll, you're going to come up to the horse's shoulder and you're gently going to grab the shoulder and just roll in slightly. And you'll know if you're doing it if they kind of pull away from you. That's how they're doing it right. And then when you're done, you just gently let go. And that's how you do the shoulder roll. Our next manual restraint we're going to be covering is the leg lift. I have my handler here for extra safety. When you're performing the leg lift, you want to remember that you only lift the front legs, and you also only lift the leg on the side that you're trying to work on. So if somebody was trying to clip Mr. B's back right leg and he didn't want them to clip it, I would hold the right front foot, or if they were on the left hind leg, I would do the left front leg. In order to do the leg lift, you're gonna reach down just like you're picking up a horse's foot, place your hand on the hoof, bring your hand around over to the cannon bone, and raise up, making sure that the toe is steady and up. And when you're done, you're gently gonna just let the toe fall back down and let the horse put the leg down. And that's how you do a leg lift. Our next manual restraint is gonna be the twitch. The twitch is on a wooden handle and it has string around the top. How you're gonna apply the twitch is you're gonna stick your front 3 hands through the twitch, like so. You're then gonna come up to your horse, grab the lip, and gently start twisting. It's important to remember to stay on the same side as your handler, and to also never let go of the twitch, as it can be a dangerous weapon if it's swinging around, and let go. Once you have your twitch on, you can hold it, and you don't want it on for about more than 8 minutes or you risk going into the blow stage. So you always want to make sure that you work efficiently and quickly. And that's how you do a twitch. The next manual restraint we're going to be covering is chemical restraints. Chemical restraints can be used to help a horse if they're having a hard time being body clipped, they're a nervous hauler, or you might just need the edge knocked off of a horse to finish what you need to get done. Your chemical restraints are going to be ACE, Rompin, and DORM. ACE and Rompin are 1 to 4 cc's, whereas DORM is much stronger, so it's going to be 1/4 to 1/2 cc's given. These restraints are going to be given IV, which would be along the jugular groove in the jugular vein along the neck, or they can be given orally with food, or DORM has a DORM paste. And that's how you perform manual restraints. Thank you for watching, and always remember to stay safe.